The aim of this video is to present an overview of the main determinants of men's health, the concept of hegemonic masculinity and its connection to risky health behaviors, and the concept of multiple masculinities and its contribution to the improvement of health in men. Before we dive into the concept of masculinities, let's paint a picture of the health status of Canadian men compared to Canadian women, and how is that difference explained? The first striking finding is that of life expectancy. In Canada, life expectancy for men is approximately 4 years lower than that of women. The second observation is the PIL ratio. The potential years life lost, or PIL, is a measure of premature mortality that provides an estimate of the average years a person would have lived had they not died prematurely. Men are 2 times more likely to die prematurely. They die 4 times more than women when it comes to mortality due to heart disease. The third observation is mental health. The prevalence of depression and anxiety diagnostics tends to be lower for men than women. However, the suicide rates tend to be much higher for men. So, what could explain these differences? National statistics show that the majority of premature deaths among men are attributable to risky lifestyle behaviors. These risk behaviors include physical inactivity, smoking, unhealthy diet, problematic drug use, and heavy drinking. Included with all those factors is a poor use of health services, including prevention services and services related to mental health. These statistics clearly show that these factors are much more present in men. Other social determinants of health account for this difference, such as gender, culture, personal and family income, education, social support, or early childhood development. But to understand the health of men, we must pay particular attention to 2 factors: culture and gender. Why do men engage in more risky behaviors and are less likely to seek psychological help? Most men are socialized at a very young age to embody hegemonic masculinity, meaning to take it like a man, and are discouraged from showing feelings of vulnerability and weakness. Masculinity, or adhering to the stereotypical masculine behaviors, plays a critical role in the health outcome of men. For a lot of men, adopting a healthier lifestyle, consulting health professionals, especially for mental health symptoms, is often perceived as behaviors that are typically associated with the female gender. This association is not well accepted by many men. The desire to adhere to stereotypical masculine behavior is susceptible of reducing one's tendency to seek aid, for fear of being stigmatized, judged, discriminated, and marginalized. This is important to understand given that the social construct of masculinity shapes men's perceptions of health, illness, and their subsequent healthcare practices that could protect, maintain, and improve their health. Hegemonic masculinity and the traditional beliefs about manhood are the strongest predictors of individual risk behaviors over their life's course. Hegemonic masculinity has been pictured by our society as the representation of all men. However, not all men adhere to risky lifestyle behaviors or are resistant to seek help. Not all men behave like the strong, silent type, so often portrayed by our cultural industries. That's why we are now distancing ourselves from the concept of masculinity and moving towards a new concept of masculinities. Using a pluralized concept of masculinity enables us to destigmatize stereotypical risky men behaviors. In addition to multiple masculinities across the category of men, what it means to be a man and living one's masculinity may change in response to life events, culture, ethnicity, sexual orientation, and age. A 2011 study by Evans and colleagues developed a framework to investigate the concept of masculinities. This framework explores masculinities as a determinant of health and health disparity between men and women, and among men as a diverse social group. Because of this study, we were able to identify health disparities among men depending on the model of masculinity they'd identify with. There's a need to mobilize what we've learned about masculinities and men's health practices and develop more men-centered interventions to meet their specific needs. There is also a need to make a significant shift concerning men-centered strategies for health promotion. Using messages and strategies that focus on the development of action-oriented goals, on action, and on raising self-esteem seems to result in better outcomes. For example, most men are independent and have a desire to be in control, so using messages or strategies that are proactive and that lead to a better self-esteem should be privileged. However, it is important to always create an environment of freedom of decision and action, such as suggesting different options so that the man can make a choice adapted to his beliefs and preferences. The use of interactive methods, such as web-based tools, can be anonymous and protect confidentiality, which is an option of choice for some men. It should be noted that it is also important to value achievements and changes that men make. Such an approach promotes the creation of a positive therapeutic alliance and the establishment of a climate of trust conducive to the improvement of positive health practices. Now, here are a few take-home messages. Men are more likely to have risky lifestyle behaviors and are less likely to seek psychological help. Stigmatization and discrimination are still negatively associated with help-seeking behaviors among men, especially for mental health issues. Moving to the concept of masculinities helps us grasp that there is a need to understand there are different ways to be a man and that we need to adapt our interventions. Thus, men-centered interventions should contain a collaborative and individualized approach, an action and goal-oriented approach, and a web-based approach.